Hi, this is Cindy Harrison recording on Grief and Loss for Nursing Fundamentals, NurseAd 101. Grief and loss characteristics. Grief is the total response to the emotional experience related to loss. It's manifested by thoughts, feelings, and behaviors. Loss is an actual or potential situation in which something that is valued is changed or no longer available. Normal manifestations of grief include verbalization of the loss, crying, sleep disturbances, loss of appetite, or even difficulty concentrating. The nurse must assess the grieving client or family member to determine the stage of grieving. There are stages of grieving as identified by Kubler-Ross, and note that these stages do not have to follow in the exact sequence. For instance, when a death occurs, a patient may be shocked and enter denial, then anger, bargaining, depression, and finally acceptance. However, as stated, the persons may enter into the various stages, out again and in again, and the nurse should note nursing implications. Factors influencing the loss and grief responses include the significance of the loss, culture, spiritual beliefs, one's gender, socioeconomic status, support system, cause of death, reason for the loss, or age. Childhood differs from adults in understanding the loss, as we described before, in death, but also in how they are affected by the loss of others, may feel afraid, abandoned, and lonely. Early and middle adulthood. Experience loss as part of normal development. Can experience losses other than death. The response is related to previous experience, self-esteem, and support systems. Losses during late adulthood may include loss of health, mobility, independence, and work role. With limited income and possible change in living arrangements can also lead to a sense of loss and grieving, and loss of a long-time mate can be profound. First, nursing assessment of the client experiencing loss includes 1. Nursing history, 2. Assessment of personal coping resources, and 3. Physical assessment. Your focus interview questions will be on previous losses, characteristics of the current loss, previous grieving, if the client is currently grieving, cultural and spiritual traditions related to the person's loss and grieving, and the support network. Nursing diagnoses for the grief process. The first one is grieving. And grieving is defined as a normal, complex process that includes emotional, physical, spiritual, and intellectual responses and behaviors by which individuals, families, and communities incorporate an actual, anticipated, or perceived loss into their daily lives. Complicated grieving is defined as a disorder that occurs after the death of a significant other, in which the experience of distress accompanying bereavement fails to follow normative expectations and manifests itself in functional impairment. Planning. Outcomes. Client or family will discuss responses to the loss, resume normal sleeping, eating patterns, resume activities of daily living as they accept loss, adjust to the environment in which the loss occurred or the deceased is missing, overall experience a sense of purpose, meaning, and hope in living, and remember the loved one without experiencing intense pain. Implementing may include silence, attentive listening, open and closed-ended questions, clarifying and reflecting feelings, or summarizing. Teach what to expect in the grief process. It's normal to experience anger, guilt, fear, sadness, and depression. Teach values of normal activities, new rituals. Accept the client where he or she is at. Provide information for support resources and encourage the client to use them. As we develop and age, our concept of death changes. For instance, when we are infants to approximately 5 years of age, we may consider death as mere sleep. At age 5 to 9, death is first becoming final. At age 9 to 12, we now understand death is inevitable, but may develop a fear. From age 12 to 18 years of age, we may fear a lingering death, fantasize that death can be defied, and may even act out in reckless behavior. From age 18 to 45 years, attitude of death is influenced by our beliefs, such as our religious beliefs. From 45 to 65 years of age, we begin to accept our own mortality and may even encounter death of our own parents. At age 65 years and older, we may fear prolonged illness, death of our peers, and death has multiple meaning. The legalities related to death include advanced care directives, if there is a durable power of attorney, or if there is an order from the doctor for do not resuscitate. All of those factors are legal issues that we must deal with as nurses. Manifestations of impending death: you will see a loss of muscle tone with your clients, a slowing of circulation, changes in respirations, and sensory impairment. Traditional clinical signs of death includes a cessation of the apical pulse, respirations, and blood pressure. According to the state of Wisconsin, the definition of death is when an individual who has sustained either irreversible cessation of circulatory and respiratory functions or irreversible cessation of the entire brain stem is dead. Death is defined by the World Medical Assembly guidelines, states that it is a total lack of response to external stimuli. There's no muscular movement, especially during breathing. There are no reflexes, a flat EEG or encephalogram, brain waves, and in instances of artificial support, there is an absence of brain waves for at least 24 hours. Related nursing diagnoses include fear, hopelessness, powerlessness, risk for caregiver role strain, interrupted family processes, and major goals include maintaining physiological and psychological comfort, achieving a dignified and peaceful death. A nursing goal is to help the clients die with dignity. Introduce options available to restore and support feelings of control. For instance, the location of care, the time of appointments with health professionals, activity schedule, use of health resources, and the time of visits from relatives and friends. Strategies to facilitate discussions about death include to identify the nurse's personal feelings about death, determine what the client knows about the illness and prognosis, respond with honesty and directness, and make time to be available to provide support, listen and respond, and focus on the client's needs. Comfort measures would address the physiological needs of the dying persons, sense for odors which may occur in dying process with fresh linens, and encourage the family to participate in physical care or touching the loved one. Another nursing intervention would be relaxation measures, which may include family pictures, music preferred by the patient, pet visits, reading to the patient, relaxation techniques, quilts, blankets, pillows from home, and cuddle time. To care for the body after death, it is very important to follow the policy of the hospital or agency. Check the client's religious rituals and make every attempt to comply. If the family or friends wish to view the body, as a nurse, make the environment as clean and pleasant as possible. Make the body appear natural and comfortable. All equipment, soiled linen, and supplies should be removed, and follow the agency policy when caring for tubes. Care of the body after death should include to place the body in a supine position, place the arms either at the sides, palm down, or across the abdomen, place one pillow under the head and shoulders, close the eyelids by holding down for a few seconds, insert dentures, and close the mouth. In continuing to care for the body after death, the nurse should wash soiled areas on the body, place absorbent pads under the buttocks, place a clean gown on the client, brush or comb the patient's hair, remove all jewelry except the wedding band which the nurse should tape to the finger, adjust the top bed linen to cover the client to the shoulders, provide soft lighting and chairs for the family. After the body is viewed by the family, leave the wrist identification bracelet on, apply additional identification tags, wrap the body in a shroud, apply identification to the outside of the shroud, take the body to the morgue or arrange for room pickup, and handle the deceased with dignity.